Okay, thanks very much, Ira, and it's great to join this panel and join you here this morning. First, I want to start off by congratulating Greg and Life Technologies for really what is a remarkable achievement. Having been involved with the whole sequencing era for many years, what was announced this week is extraordinary. And the whole idea that Greg has laid out regarding how, for example, in the near term, someone with a newly diagnosed cancer would have their therapy individualized rapidly and an affordable, much less than the typical scans that are done for cancer today. This is really an exciting time here in 2012. And so that actually speaks to the larger problem we have, is that our medicine today is not individualized. I hate the term personalized because it sounds like a concierge thing, but individualized is the one I favor, because each individual is unique. We have our own biology, our own physiology, our own environment, and the way medicine is practiced today couldn't be further from that. Everyone's supposed to have mass screening. All women age 40 have a mammogram every year, for example. All medicines that we give them to all the people with a particular diagnosis at a particular dose. We don't have any adjustment for individuality. So now we have a new world, a reset, and actually what I think is really the rebooting of medicine. And that's why I picked this Schumpeter term, creative destruction of medicine, for the book that is pre-released here at CES, officially out at the end of this month. And the whole concept is that we can get the data, whether it's the sequence and the biologic data, all the omics. Is not just the DNA sequence. Obviously, it's the proteins, it's the metabolites, it's the epigenome, all these omics. But in addition to the biology, we can understand the physiology. I'll show you a couple of examples of that, as well as the anatomy through portable, for example, high-resolution ultrasound as one technique. And this creates a comprehensive panoramic view of each individual, what I would call high-definition man, which we've never had access to before. So, for example, if we were interested in somebody's blood pressure, I'm a cardiologist, I see patients every week with blood pressure. Most every patient I see has high blood pressure. I say, can you get us some value so we can adjust your medicine? So more than 50% of people who have hypertension don't have their blood pressure adequately regulated, and they're sitting ducks for a stroke or a heart attack. And so, if you can get that data not only more frequently, but how about every few minutes, if need be, and even during the night, even when the person's having emotional upsetness or an argument, that's a whole new window we didn't have before. And the same for glucose and for heart rhythm and so on and so on. So now let me just show you the fact that we can capture this data now, and in a seamless way. So actually, this first device I'll show you is invented by Dr. Dave Albert from Oklahoma, who's here in the audience this morning, and it actually gets your cardiogram on the phone. In fact, when I see patients in the clinic, I don't even do an expensive cardiogram. It's for free, right on the phone. And basically, it's an add-on to the smartphone. It has sensors in the back, a case, and if I just pop this on my phone, and what I can do is call up that AliveCore app, and I'll just fasten this in here. You can see it, and I can just put my fingers on the back. And you probably can't see this because I need sunglasses to stand up here so bright. But it's actually my heart rhythm. And I can put this on multiple leads on the chest, the sensors, and get heart rhythm. It's really pretty remarkable. We've never seen a cardiogram right on the phone. Now, another thing I wanted to show you real quickly is, how about diabetics? There's 400 million diabetics on the planet, and there's over 1 billion pre-diabetics. No less, all of us would like to know what our glucose does throughout the day if we could get that kind of education, because it really changes your lifestyle when you're following your glucose every minute. I have one of these sensors on right now, and here's a phone, the first phone ever that can get the glucose right on your phone every minute. It's a product of Dexcom. And so if I just turn on the phone, I just put it right here, and this is my glucose right now. It's a little high, 120. I had a couple of red things in the back. But besides that, I can look at my plot for the last day. And besides that, I can send all this data to a doctor or to my Facebook friends, anywhere I want. Now, that's a whole new look. And the last thing I want to show you, and that's of course with all this digitizing physiologic data, it's not just any vital signs, your brainwave data, anything. And then this is what something is an outgrowth of the data that can be generated from DNA sequencing is we learn the pharmacogenomic interactions. Because we spend over $300 billion a year for drugs in this country alone. And most of that, believe it or not, is waste. Because we don't match up the right drug or the right dose with the right patient. And we also induce horrendous side effects that result in hospitalization. Well, how about if you know the particular variant in the genome, and you can test that with a handheld genotyping device, which is what this is, very quickly, within minutes. And this is a product of DNA Electronics, and there's other handheld genotyping. This is not sequencing, this is just looking at one variant base, but it's the key one for doing prescriptions and matching up things precisely. Now, the last thing I want to just mention is how is this whole new digitization of man and rebooting of medicine going to occur? Is it going to happen through the medical profession? No, I don't think so, because this is a profession that is very resistant to change, incredibly resistant to change. So I think that the only way this can go forward is through a consumer health revolution, because it's the data that each person has. For example, in the New York Times this morning, there was an article about should patients have access to their medical records and notes. Why could that even be a question? It's your health. It's your records. You shouldn't have access to it. Well, that's the kind of problem we have with the medical profession is the doctor knows best, the kind of priesthood attitude that's been there for a long time, and we need to change that. And consumers can come together. We know we're at this point in our civilization. We've seen the Arab Spring, we've seen the Occupy movements, we've seen all sorts of ways through social networking that people have come together like never before. And that's what I'm hoping we can spur here with some of the discussion this morning. Thanks.